Amamuddin Sadar's loved ones are walking a path of grief.
Let's everyone wish that we see him at least one more time.
His partner, Becky Ramadani, will never get to see or hold him again.
He was my soulmate, he was my darling. But he left us too early, he shouldn't go.
A refugee from Afghanistan, Amamuddin arrived in Australia 13 years ago. His family have made the long journey to Australia to help plan his funeral.
Some part of my brain is accepting it, but some part of my brain is not accepting it still. And I'm in a very deep shock.
He was more than a brother, more than a father. I lost my everything on that day.
That day, the 17th of February, Setefano Leotoa, who had recently escaped from Cumberland Psychiatric Hospital, went to a shopping strip in Marylands with a knife. He allegedly wounds a man and a woman and stabs Amamuddin, who died outside his friend's business.
I could see the pain and suffering in his eyes. And I was trying to do everything to save him, but I couldn't.
Rafiq Ziai was there as Amamuddin died. He says the community is still on edge.
People, they're really worried about their safety. They have concern about the safety to come here.
The accused killer isn't the only case of a patient absconding from Cumberland Hospital. On February 8, the day after Setefano Leotoa broke out, another man also escaped. Luke Francis is alleged to have stolen a car and caused a crash that killed 2 women.
It's a shame and it's horrible that people died for this attention to come, and we've been trying to get this spotlight on mental health services for a very long time.
Nick Howson is a delegate for the Nurses and Midwives Association. He's been working at Cumberland for a decade.
We're a very large facility. We care for a large amount of patients. It stands to reason that the rate of people who run away from care there would be higher than everybody else.
He says hospitals aren't prisons and the focus needs to be on patient health, not security.
We shouldn't get to the point where people are attempting to run away from care or to fight with healthcare professionals. We should not be reaching there.
Days after the killings, the state government took the unusual step of placing the hospital under administration. It was already scheduled to be shut down in 2027 to make way for a new facility. But until then, they've promised to increase security.
These tragic events could have happened in any hospital across our state.
7:30 asked the government how many people abscond from mental health facilities across the state. The data provided shows almost 22,000 patients were admitted involuntarily to mental health facilities last year, and 191 patients absconded from secure mental health units.
People with severe mental illness are much more likely to harm themselves or to be victims of crime than they ever are to harm anyone else. So these are really rare events. But absconding, that's not really that rare. If we want to prevent these sorts of things happening, the best thing that we can do is to improve our mental health services so that we can actually provide care for people much earlier in the piece before they become so unwell.
Before being admitted to a mental health unit, most patients first have to attend an emergency department. 7:30 can reveal one young man ordered by law to attend a mental health facility first had to wait here at Westmead Emergency Department for more than 4 days before a bed was made available. But last week, he wasn't the only patient who experienced this. Another man waited even longer across a 4-day period before a bed became available. One doctor has told 7:30 it's akin to torture.
In Australia, we have 27 beds per 100,000 people. If you look at the international standard, it should be around 60 or above. And then if you look at community care, there is just a complete decimation of our outreach community mental health services, which means that people need to reach crisis point before they can actually access care.
Recently, psychiatrists met to discuss how to improve mental health services in the wake of the 2024 Bondi Junction attack, where 6 people were killed by a man experiencing psychosis.
So, good morning, everybody.
In attendance is one of the newly appointed administrators of Cumberland Hospital, Matthew Large.
At the moment, I think the system is being, in a way, asked to do too much with the resources that it has.
Do you think the Minister for Mental Health takes those views of yours seriously?
I wouldn't want to talk for the Minister for Mental Health.
It's obviously she has a critical role in ensuring that the ideas and solutions that are raised, though, are acted through on, though.
I'm sure that she's listening and paying attention, and I think it's an extraordinarily difficult job being the Minister for Mental Health.
Matthew Large says services can't be improved without more funding.
Mental illness currently accounts for something like 8 to 10% of the disability associated with all medical problems, but is funded at a level of about 3 or 4%.
A question for Minister Jackson.
7:30 put this to New South Wales Mental Health Minister Rose Jackson.
7:30 spoken to one of the administrators you've appointed as the New South Wales Government of Cumberland Hospital. They say the only way to improve outcomes there is by spending more money than you already are. Is the government at all open to taking that advice seriously?
Yeah, I mean, we are investing records amounts in mental health, actually. For the first time in the last budget, the mental health budget in New South Wales topped $3 billion. But of course, we're always open to conversations about how we can do better.
The Minister also told 7:30 serious adverse incidents from absconsions are extremely rare, at less than 0.01%. That statistic is little comfort to Amamuddin Sadar's family.
The pain that I have, no one should have it. And I don't want anyone to have the same pain. Such a deep pain that I have in my heart right now.